People come to us for breast augmentation consults for a number of reasons and with a number of goals. I would say, obviously, everybody who comes to our office is looking to be bigger, but one of the most common things that people tell us when they're here for our consultations is they're really looking to change the way they fit into clothes. They have certain articles of clothes they just don't fill out the way they want to. So they don't like the way they fill out a bikini. They want to be able to, or they want to wear strapless clothes. They want to wear a strapless dress, or they were just at a wedding and the dresses that the bride picked out don't work for them because they don't have enough breast tissue to hold the dress up. So the way people fit into clothes ends up being a really common theme in our office. In terms of the consultation process, we usually schedule people for about an hour. That gives people plenty of time to do a few things. One is I always start with trying to establish what are the patient's real goals. So I always ask my patients, be really honest with yourself and then with me, because the better I understand what you're coming in for and what you really want, the better I can put together a plan that's going to make you happy. So for example, people always come in and the most common thing people will say is, I want to be a full C. I can almost write it down before people walk in the door. There's something in the United States where people are it's a cutoff between being normal and being afraid of being too big if they're a D. So, but a lot of people end up wanting to be a D. They have a hard time expressing it. So number one, figure out what your goals really are. Are you looking for a subtle change that nobody in the world is going to notice? Are you looking for the kind of change that your best friends might notice depending on the clothes you wear? Or do you want the kind of change that you walk into a room and everybody stops and looks at you and says, who did that for you? So establishing goals is really critical. So during the consult, we'll go over that first and foremost. So what are your goals? And then what I do is I walk patients through the process of the decisions they have to make. So the way I think about breast surgery is there's 4 main questions that a patient has to answer. The first one is size, obviously. So people are coming in to change their breast size. Well, there's a number of ways that we figure that out. So one of the questions we'll ask is, what cup size are you now? And what cup size do you think you want to be? And then as soon as they give me the answer, I tell them that cup size is sort of meaningless. And here's why. I'll have on any given day, we'll see 10 different breast consults. And we always ask what cup size you were, and a woman will stand up, and we have women who have a breast this big and call that a D, and an hour later we'll have a woman with breast this big, she'll call that a D. So which is the D? I don't even really know, and I do this for a living. It's not like shoe size where a 7 is a 7 is a 7. But we always ask because what it really gives you an idea of what kind of a change are they looking for. The patient who says, I wear an A cup and I want to be a D cup, that's a pretty substantial change. Compared to the person who says, well, I wear a small C and I want to be a small D, more subtle change. So it puts things more in perspective. Implants aren't labeled A, B, C, and D. They come in CCs, but when somebody says I want to go from a B to a C, I have an idea of how many CCs it might take to get them there, but we never promise a cup size because every patient wears their bras differently. In terms of how we really arrive at that answer then, one is we always measure patients. So patients will stand up and we'll take the measurements of the breast, and that will really tell us what range of implants fit. The same way if I measured a woman's body, I could say, well, you're a size, this is your dress size, and this is what you should go shopping for because that's what's going to fit you. And you really want to respect those measurements. As long as you take good measurements and you respect those measurements in your decision making, you should get an outcome that's really very pretty. Where people get into trouble is they measure and they're appropriate for one size implant, and they pick something very different because their friends got those implants. So, they might measure out to a 350, but all their friends had 600s. Well, and that person who's 5 foot tall, weighs 105 pounds, that 600cc implant's probably not gonna work out too well. Whereas if you follow those measurements, you usually get a great outcome. The other thing that we have that's really special in our practice is our Vectra 3D imaging system. So it's a device where you stand in front of a 3D camera and it takes a photo of the body, and then it processes an image it's a 3D rendering of that patient. It's then linked to a computer software program that we can show you what you would look like with any size or style implant on the market. So right while the patient's sitting there, we can show them what they look like with that 3 or 4 or 500 cc implant. So they get a very good idea of what they're getting into. It really is helpful for the decision making, both for us as well as the patient. So that in a nutshell is the size. The other thing that we offer patients is what we call a bra fitting session, where we give them a sports bra. They can try out different implants. It's not an exact science, but at least it gives patients some sense for how they'll fill out clothes when they're wearing their implants. So that's the size issue. The second question is, where do we put the implants? We have 2 choices. You can put the implants above or below, and if you want to get really nuanced, you could say you have 3 choices. You can go above the muscle, you can go below the muscle, or you can do what's called a subfascial approach, which is sort of in between. But big picture, we're really talking about above or below the muscle. In my practice, I typically go below the muscle because I believe the muscle gives you a little bit better coverage and you have a lower risk of what's called capsular contracture. Another thing that I think is really important for patients to learn about is when implants are placed above the muscle, it also takes away the quality of their mammogram because it blocks a little bit more of that breast tissue. So from a pure mammography point of view, you'll get a better mammogram with your implants below the muscle. The next question that people ask us is, what incisions can we use? Well, there's 4 incisions you can use. There's only 2 that I really do. So the belly button I don't think is a great idea, and you can only put saline implants in, and very few people these days use saline implants. You can also use the armpit. The reason I don't like that scar is if you're wearing something strapless and you go to wave, everybody in the world can see that scar. It usually hides very nicely, but it's a potentially visible scar. Whereas scars on the breast you don't see, like very few people see those scars. So the 2 scars on the breast are either the bottom edge of the areola or the very bottom the bottom breast, called the inframammary fold. I tend to prefer the inframammary fold. Number 1, I think I just do it better. But number 2, there's a lower risk of one of the many complications associated with breast implants. That one is capsular contracture. So people tend to do better long term. Not everybody's a candidate for it, but when they are a candidate, I usually try to encourage people to use that approach. The last question that we always talk about with patients is which implants we want to use, silicone or saline. In my practice, I use probably about 98% silicone implants. I think that they give you a softer, more natural look and feel. And then when we ask our patients, whether they're a cancer patient or cosmetic patient, any patient who's ever had both, which a lot of patients have had, anyone who's ever had both, about 98% of those patients will tell you they prefer their silicone because they just feel more natural. Occasionally you'll meet patients who really like the feel of firm, overfilled saline implants, and that's fine. We try to make those patients happy in that regard, but most patients are looking for something that looks and feels as natural as possible, and silicone tends to give people that result a little bit better. So those are really the 4 key questions about breast augmentation surgery.